Evan.
This is for you, Evan. Yeah.
I got a couple other things. These, I don't know if you can see, they're still kind of colored. So these are from, what, did you guys watch the Olympics?
Kind of.
Who didn't?
Did you see,
Kind of.
did you see Bob Costas' eyes?
Yes.
Okay, pretty nasty. So these are from somebody I saw yesterday that had nasty stuff. Anybody want to pass these around? No?
Yeah, give it to Megan. Yeah, give it to Megan.
Oh, yep, I looked.
Okay, how about, does anybody know what these are?
Biohazard.
Okay. So they're actually, they've got like old needles in them that people have injected themselves with. Anybody want this one?
I'll pass it around. I'll pass it around.
Okay. Okay, why don't you want to pass this thing around? Okay, but what if I told you they'd only been used on people with diabetes?
That would be
Okay. You have diabetes? Okay, so if we pass these, do you use insulin? You don't do shots? Okay. If you, why don't you want to pass them around? Even if it's diabetes? Why? Okay, wait. What did you say?
I said because that's nasty.
Okay, why is it nasty?
They injected themselves.
Okay. Would you get diabetes from it?
No, but you could get sick.
Get AIDS.
Okay. Okay, so you couldn't. She said you couldn't get diabetes from it. What? Could you get anything else from it?
Yeah, you could get infected.
Okay, I want to remind you to be respectful. We need to stop talking. If you have answers to questions, then you need to raise your hand. But we shouldn't be talking.
You could get an infection because it punctured their skin and from blood and tissue and stuff on them.
Okay. All right. So can somebody then tell me the difference between a communicable disease and a non-communicable disease?
A communicable disease is being able to be passed on through contact and stuff, and non-communicable disease is like diabetes, and it's genetic.
Some of it can. Okay, so you were right. So there's a reason that you don't want to pass the needles around.
Candy.
It's actually Starburst.
The needle from there.
All right. So what? Give me other examples of a non-communicable disease, which is the same as a non-infectious disease, besides diabetes. Asthma.
Yeah, some cancers.
Cancer. Arthritis. Okay.
COPD.
Okay. You got another one?
Carpal tunnel. Wait, no, that's
Carpal tunnel.
Yeah.
Okay. So these are all things that you can't spread person to person by contact. Okay. The World Health Organization, which kind of keeps track of all this stuff for the world. Non-infectious diseases kill 36 million people every year.
Whoa.
Okay. The main four, if I can remember them, are cardiovascular disease, so like high blood pressure, high cholesterol, heart attacks, cancer, I think the other four. Respiratory diseases like COPD, asthma, and I just forgot the fourth one. Alcohol-related diseases. So the top risk factors. So how do you get those things? How do you get cancer, and how do you get diabetes, and how do you get all those things? Can you control it?
Yeah.
Yeah, you know about it. Some things you don't know about it.
Okay. Anybody else? Josh?
Heredity.
Okay, Okay, so genetics. Can you do anything about genetics? Can you pick who your parents are?
No.
No? Okay. That's one of the things you can't do anything about. The other ones, the top causes of all those diseases are tobacco use, alcohol use, lack of exercise, and poor diet. That's what causes the majority of deaths from non-communicable diseases, are those four things. So if you eat right, you stay away from tobacco and alcohol, and get plenty of exercise, you can prevent a lot of those things. Okay, now how about communicable diseases? Do we have examples? Flu? Pink eye?
Is bronchitis one?
Bronchitis?
Having cold?
Cold?
Would whooping cough count?
Uh-huh. Okay. They're communicable because they can be, the way I always remember it, they can be communicated, or they're passed by ways we communicate, right? So we talk face to face to somebody, we shake their hand, we sneeze on them. However we transmit things, then we share those diseases. What time are we done?
You have about 10 more minutes.
Okay. All right, has everybody had a chance to look through the book? Or is that
No.
There? Okay, I'll talk to you a little bit about some of the things that I see in my office, because I deal with both types of diseases. Anybody have an idea what's a non-communicable eye disease?
Would that's high.
I don't know if we'd classify that as a disease, but it would be a defect that would not be communicable.
A sty?
No.
Stigmatism?
Astigmatism? Okay, so the reason you wear glasses, we'll group all those together. So nearsighted, farsighted, astigmatism. Those are things that if you hang out with your friend that's nearsighted, you're not going to become nearsighted, right? They're not going to give it to you. Styes, we'll talk about it in a minute.
No, there's a word for something you cite
Right. Are you thinking macular degeneration? Okay. Macular degeneration is one that we see every day. Okay. I had a few patients yesterday that have macular degeneration, and they're slowly losing their vision. Do you want to know what the number one way to prevent macular degeneration is?
Don't stare into the sun.
No.
Don't put your phone right here.
No. Mac and cheese.
Don't look in other
No. This is one thing. If you, this might be the most important thing you pick up today. The one thing you can do that drops your risk of having macular degeneration and going blind. Anybody else want to guess? Falling. Water? No.
Did you say coffee?
Anybody? We actually already talked about it.
Needles.
All right. The number one thing that progresses macular degeneration is smoking. So we always talk about smoking causing cancer and lung problems, right? Add to your list going blind. Okay, if you don't want to go blind, then don't smoke. That's the number one. The number one thing. Do you want the full answer?
Yes.
Do you want me to tell you after? It may take a while. Macular degeneration is like rust in your eyes. So like when your car rusts, like when metal rusts and it gets gross, that's basically what happens in the back of your eye. And smoking progresses oxidation in your body. Okay? So when you smoke, it speeds it up. When you stop smoking or don't smoke, it slows it down.
So is it the smoke or the tobacco
it's the effect of everything that's in cigarettes. Okay? Same thing with the rest of your body. So we can talk about a bunch of this stuff. You can ask your teachers about, ask them about free radicals, ask them about oxidation, and we'll see if you get to talk about it.
My friend's grandma had a detached retinal nerve, and they put it back on.
Right.
How did they do that?
There's a few
Go
ways.
back into the eye.
A detached retina is the lining of your eye that comes off. So we had a lady a week ago that had that fixed, and they actually take a needle and they inject an air bubble into your eye. Okay, so your eye's full of fluid. What happens when you put air inside fluid, like in a water balloon?
It blows
Doesn't
up.
work very well.
It rises to the top, right? So she had, hers was detached in the back,
Yeah.
so they put an air bubble in it, and then she sat on a table and slept face down for 2 weeks.
Oh,
So that, yeah.
she had a nice crease.
All right, let's talk. And that would be a non-communicable disease, right? Okay, do you have other ones?
I forgot the name of the eye disease that it has that white powder thing that goes over your eye.
Cataracts?
Cataract.
Very good. Cataracts would be
So
non-communicable.
do carrots really help your eyes?
Yes,
Don't eat
but they're not the most important. Kale and seaweed. And fish.
Yes. Yeah, I'm good now.
And broccoli.
Yes.
Okay, all right, so non-communicable diseases. Diseases that I see every day that can't be spread from person to person. You've got a lot of them. Glaucoma is one, which is where the pressure in your eye gets really high, and you can lose vision from it. Diabetes we see every day. High blood pressure we see every day. We said macular degeneration, cataracts, and a whole bunch of other stuff. Most of that book you're looking through, most of those things are going to be non-communicable diseases that don't get spread. Yes, sir. That is what? Weed? And it lowers your pressure. Seaweed? Or marijuana? It lowers your eye pressure. So there's states that use it to treat eye diseases. We'll talk about that if we have time here. All right, somebody tell me infectious diseases or communicable diseases that I would see every day.
Pink eye.
Pink eye. That's a big one. Does anybody know what pink eye is? You hear about it at school all the time because if somebody has pink eye at school, what do they do to you? They send you home. Right? They won't let you come back. Okay. So there's different types of eye infections, and we'll talk about this for a minute. So when we talk about pink eye, it can mean a lot of different things. So it can mean, Jim, have you talked about viruses and bacteria?
Yeah, we're getting there.
Is that what you're on now? Okay. Okay, so you can have a viral infection of your eye, and you can have a bacterial infection of your eye. And this is true of other parts of your body. How do you treat bacterial infections? Do you know? Antibiotics. How do you treat viral infections? What? Right. Now there's certain viruses. So a couple weeks ago, we saw a guy that came. He'd been seen at his family doctor because his eye was all red, and they put him on antibiotics for 2 weeks, and it just kept getting worse and worse and worse. And they finally came to see me when I saw him. They had a herpes infection in their eye. Okay, which is pretty common. It's like having a cold sore, but it's in your eye, and it won't get better. And you can do antibiotics, and it won't get better. But there's a few of those viruses that we actually have medication that'll fight the virus. And so we put them on antiviral pills, and it cleared up in about 2 days. So most viral infections, like when you have a cold, you can't really do anything, right? You go to the doctor and they don't really do anything. If you have strep throat, what do? Yeah, so they give you medicine and it fixes it. So those are the two most common causes of infections that can be spread: viruses and bacteria. Bacteria usually, like with eye infections, a bacterial infection, your eye will get really, you probably looked at some of the pictures in there, it'll get like yellow, green, snot stuff that comes out of your eye. When you rub it, and then you touch things, and you shake hands with people, and they touch their eye, that's how you spread it. So if you don't rub your eye and you keep it clean, you can actually, a bacterial infection won't spread that fast. A viral infection, viruses tend to travel more through the air. They travel through the air easier, so you don't have to have direct contact. So if you have a viral infection, and you guys were sitting over here on the couch like this, and one of you had viral infection of your eye, we'd be pretty safe to say that within a couple of days, the other one.
Yep, Megan.
Okay.
Megan, you can
Yeah.
take away for a long time. Bye, Megan.
So communicable diseases can they're generally short, and they can be treated with, a lot of them can be treated with medications, antibiotics, antivirals. Sometimes we use steroids with them. Non-communicable diseases are generally long-term. You have them for the rest of your life, or you have them until until something's surgically removed, or like with cancer, it's generally a long thing. You can get rid of it with surgery and radiation and chemo, but it's it takes a long time and a lot of work to try to fix those things. The other ones are generally short, and we get those infections all the time because there's stuff in the air all the time. All right, any questions on anything? Anything I need to talk about?
You said great things.